So I'm Chris Maliken. I grew up in Buffalo, New York, went to undergrad in Syracuse, continued on to do dental school at the University of Pennsylvania in Philadelphia. At that point, I also entered into the military in the Navy. After dental school, I had the opportunity to complete a oral surgery residency, which was in Portsmouth, Virginia. During that time, we actually rotated with Rockcliffe at Mission to get more experience for facial trauma. And it was at that point that I met the group and met my wife, and I ended up completing time in the Navy at Camp Lejeune, and then moved here basically last summer after completing that time. My wife, Christy, and I have 4 kids. They're pretty broad ages. So we have a teenager, 17, we have an 11-year-old, and then our younger ones are 3 and just a little bit over 1. When I was first looking into going to dental school, I rotated with some dentists when I was in undergrad. Also had me rotate with an oral surgery group just to get some more experience. And basically after seeing what the scope of practice that they were doing, I just became interested in the specialty. And so even early on in dental school, I kind of knew this is what I wanted to get into. This practice has been around for over 40 years. We have a growing practice, and there are different docs within our group that have different specialties. And so I think having that diversity is very helpful. For instance, if I have a patient that looking to seek some advice from a colleague, there's multiple other providers that I can reach very easily within our group. So I think for anyone looking into our practice, who has maybe some concerns or some hesitancy about having a surgical procedure, they should know that we have a broad group of doctors with diverse interests. We cover a pretty large area of Western North Carolina. And at any of our locations, with any of our providers, they're going to just receive an unparalleled amount of care and compassion. And knowing that at the end of the day, they're going to have a surgical procedure that was safe. If they were under anesthesia, they're not going to remember anything from it. They're going to wake up and think, hey, that wasn't so bad.